Unless you're living under a rock somewhere, you've been using flexible partials versus what you learned in dental school, rigid partials. What's the difference? There's a lot of difference. Now, there's a Valplast partial on a Kennedy Class 1 situation, bilateral distal extension. And if you visualize chewing a piece of tough meat on the distal aspect of that, what would happen? It would torque distally. Is there anything to stop it from going distally? No. Is there anything to stop it even around the clasp area, which is a tooth-colored clasp? No, it'll still go down around those. You just thought about one of the negative aspects of a flexible partial. And we're interested to tell you that they're approaching 50% of partial use right now, or more in certain laboratories. Patients love them. Patients feel that they're aesthetic more than the ones that contain metal. The metal obviously is hard. This material is relatively soft. Therefore, I'm frustrated. I'm a prosthodontist, and most of you don't even know that. And my peers would say, don't use these. Well, I can't go against the flow. I know you're using them. There's the inside of the flexible partial, and there it is in the mouth. On an old guy, we didn't bleach the teeth, so he's got a few teeth in the anterior. He loved it. That went in with no adjustments. Now let's look, on the other hand, at a partial that is metal. You're going to look at the inside, and you're going to look at the outside there. And what you're seeing is that partial goes right down to the gingival tissues. So will it condense or squish down the gingival tissues? Yes, it will, but not much, because there's no flexibility or only slight in the metal. Look at the clasps, how thin they are. Look at the lingual clasps I have on the premolars there. Look at the facial clasps on the molars. They're not going to show. That won't show at all in the back of the mouth, but it will retain. And now, we did a video on this just a while ago, and I asked one of the patients we did in the video, does this partial ever fall out? And she said, no, it's never even hardly moved. And that is the real advantage to a tooth-borne partial. The metal on that is very thin. I should be able to take a hold of it on the right and left, and with caution, I can actually make it move slightly. I can make the clasps move. Notice how deep the rests are. I've gone into old composites or old crowns. If there's neither there, we'll put a composite in and make deep rests, which means it cannot move lingual or facial. Once it goes down into that rest, it's there. It's not going anywhere. Partials such as this are highly superior to the flexible partials. I'm not trying to discourage you from the flexible partials. I'm just saying when you use one, the patient should be strongly advised that this has some negative characteristics. It does, in fact, sink right into the soft tissue, and eventually the occlusion becomes minimal on it. Whereas the rigid partial, it'll wear the teeth somewhat, the teeth on the partial, but it cannot sink into the soft tissues. It's interesting to see over the years how many of these soft materials have come on the market, and there are many of them. Valplast is still by far the most used, and they're not expensive. As you look back at that partial we put in this older fellow, inexpensive. That one was so inexpensive they actually made two for me to make sure I was happy with it. When he wears one out, he can stick the other one in. Interesting where we've gone. What's my bottom line on this? The metal-supported partial is highly superior, but there are situations such as short-term use or healing situation or periodontal challenges where a soft partial is still indicated. Use both. Thanks for being with us. Join us next week.